Greetings everyone, I'm Shujaat from Medicos lectures by Shujaat, and today we are going to talk about neonatal mastitis, a very important lecture of pediatric surgery. So we are going in complete detail of neonatal mastitis. So let's first talk that what actually neonatal mastitis is. Word is showing its fate, neonatal from neonates and mastitis. Titus from inflammation and mastitis is from breast. So it is an inflammatory condition, or we can say cellulitis of breast, which is localized, and ultimately that cellulitis is accompanied by a abscess formation. So localized cellulitis of breast accompanied by an abscess formation occur most commonly in infants having age less than 2 months. So when we talk about pathogenesis, so pathogenesis are streptococcus, a main infections that are going to be a contributor of neonatal mastitis. Staphylococcal infections are major, and minor include E. coli, Salmonella, abscess, anaerobes, and beta streptococcus. E. coli, anaerobes, and beta streptococcus are minor, and staphylococcus are major, that are contributing ultimately to cause this neonatal mastitis. How it occur? Basically in our subcontinent, mostly parents are not that well educated. So when they see their child, its breast is inflamed, so they basically peep it up. They can cause a rupture to the breast. So due to that rupture, infection came up, like staphylococcus bacterium, they came up, and ultimately they get mounded up here, they take control of that cells and they start inflammating. So this is how pathologically it occurs. So after that, swallowing, tenderness, and erythema are few features of it. Whenever there is swelling, there is redness, there is pain, there is tenderness, temperature is slightly high. So that's how basically the clinical features of this. How we can diagnose it? Diagnose are three main steps for diagnosis. First is to check the CBC. So that basically show the white blood cells count is greater than 10,000 or even more, and that shows there is an infection that is happening in newborns. And blood culture is also an important to identify particular bacterium which is affecting. And pus drainage, like from breast we can take sample of pus, and after when we do the test for that to check which bacteria basically there, so that's basically we say it is pus drainage. And we often see that mastitis develops in breastfeeding women as well. So let's compare mastitis with breastfeeding women, how neonatal mastitis occur, how mastitis in breastfeeding women occur. So in breastfeeding women, basically what happens that when babies suck, so improper suckling can cause some rupture, and due to that there is infection occur. So that's first cause. Second is more milk production occur than the required, and due to more milk production, milk accumulation occur in breast, and due to that accumulation basic infection came up, and ultimately mastitis condition developed. So that's how it occur in breastfeeding women. And neonates are basic major contributors are infectious staphylococcus infection as well as E. coli, anaerobes, and beta streptococcus. Treatment include, after when we do diagnosis of diagnostic tests as well as we see clinical features, so we are going to move towards treatment. So that include vancomycin, first line basic in case of MRSA, methicillin resistant staphylococcus aureus, nifacillin, clindamycin, and these antibiotics are basically of main importance to treat mastitis condition. So when there is some complication even after treatment, so we are going to move towards an IV antibiotics to get control of those complications as well as to shift it towards treatment and to shift towards recovery basically. So abscess can also be treated with help of surgery. Means of saying, like by surgical intervention we can drain at that abscess, and ultimately we get rid from the abscess. So till here in quick overview what we discussed definition of mastitis, we discussed its microbiological complication as well as pathophysiology, and we discussed its clinical features and diagnostic test, and then we discussed treatment and compare it with adult breastfeeding women, how it occurred in those adult breastfeeding women. So till here, if you have any query, you can directly ask me. I just request you that don't forget to subscribe Medicos Lectures by Shujaat. Thanks so much, guys.